Today I want to talk to you about what really is true predictive analytics. There's a lot of talk about doing predictive analytics, but when I go to talk to people about the process that they're using, it really isn't at predictive analytics. So I want to talk a little bit about what it really means. There's many companies that I have heard say they're doing predictive analytics. So how do you tell when someone says they do predictive analytics that it really is predictive analytics? Because oftentimes that is not true. Now, there are companies out there that do true predictive analytics, which are will be very useful for you improving your outcome. Because what predictive analytics does is a correlation or a analytic process that shows relationship, what's relating to my outcome. That's one thing. But you really want to have a process that is going to give you options for improving your outcome and action planning. If someone says that they are doing predictive analytics, they should be addressing things like, this is our measurement model. They should be giving you a list of variables in rank order of these are the variables that we've identified are important. They should be working with you to update their measurement model because your organization is dynamic. It isn't static, and as you add new things that relate to the outcome, that company should be including those in an updated model of measurement. The other thing that I often see in companies that are using predictive analytics, or they say they're predictive analytics, is they're using an algorithm or a model that is from another organization, another state, another country, another context. Now, the problem with using a static model is that it may be a model that is from a community that's very different than the context you're working in. Well, what that's called, if you use that, it's called a misspecified model. So you want to be able to work with a company that will help you develop your own model that will measure and predict your outcome of interest. So those are a couple things that I see as the initial flag of what is true predictive analytics versus what is labeled predictive analytics, but will really be no more use to you than a case study of just identifying a single variable. The other thing that you can do is if they have a webinar, I would jump on that webinar and just ask some of the questions that I've posed already and ask them how do they respecify models. Ask them where did they develop if they say that they have algorithms, ask them where they developed them and how they were developed, what kind of context they were developed. And you should be listening for not just a simple single predictor that they're reviewing, but it should be a list of predictors that's derived from a complex model. Because predictive analytics are not simple, it is complex, but it should be very applicable because if it's contextualized and it's derived from your organization, the data should resonate. If it doesn't resonate, it's not going to be actionable. But it will resonate if the model is developed from your organization. So those are some things that you want to look for in the webinar or on their website. So let's say then that you do find a company that you do like their model. It isn't specified for your organization. It is from a static model that was derived from previous research, but you like the company. Well, I wouldn't discard that company if you like them, but let's look at how can you work with that company to be the company that makes a model specific for your organization. So let's take that static model and say that you say, you know what, all of these variables that you say are important as it relates to this outcome are in the literature. So we have buy-in. We think that this is a good model. However, ask them if they would work with you to respecify that model to be contextualized. So what you would be building, it's called a structural model, is you want to identify all the possible variables that relate to your organization. Now, it may not be occurring at this time because healthcare organizations are dynamic. And what's predicting that outcome of interest this year may not be next year for various reasons, or it might be new from years before. But these are variables that sort of wax and wane. Let's say, for example, that short staffing is your primary predictor for your outcome of interest, like falls or infections. but you don't always have you're not always short staffed, so that may go away. So work with the company to tell them you want to start with this using this model, but that you would like to examine variables that are specified for your context. And if they are able then to respecify that static model and contextualize it for your organization, then I think you're okay. But it's a matter of working with the analyst and the programmers who understand how to update static models to be contextualized and specified for your organization, so you're addressing the dynamics not only for your organization, but as those models change and wax and wane, you want to be able to monitor that over time in real time, because your action plans will change because the predictors change. Now, for those of you that are listening that are novices to math, or that's you just have a aversion to math, you may want to know some of the terms that you can look for within their discussion. So I'm just going to give you a few terms for you to look for in the discussion. And don't be afraid to ask your company that you're interested in to be technical, because you're interested in learning what they do, that you would maybe even do some research in what they're saying to you. So the predictive analytics at its very basic form is correlations. So if they start talking about what relates to, if they start talking about independent or dependent variables in a technical way, that's a good sign. If they move toward conversations about regression equations, that's where they look at the dependent variable, your outcome of interest, and then all the independent variables are all the aspects of your story that you think are predicting that outcome. They may even mention structural equation modeling. That's the next step after regression. A structural equation model is basically lots of regression equations all studied at the same time. So you're able to explain very complex scenarios of what's occurring, both directly and indirectly, with your outcome of interest. They also may talk about doing a time series study. So they're looking at how does time change the predictors of that outcome. They may talk about something called ARIMA, ARIMA, and it is a odds ratio methodology to forecast risk. So they actually use the historical data to examine the trends and then forecast based on the odds ratios what might be happening 2 weeks, a month, 2 months. But those are just some of the terms that you might be looking for. You may even want to even just do a search on terms related to predictive analytics. Make a record of those terms and look for those. And it's not to be gotcha with them, but you do want to make sure that you have consultants, analysts, engineers that really do understand what predictive analytics are, and not just saying, based on our scheduling program, you're going to have 3 vacancies or holes in your scheduling next week. So you want to go beyond something that's very simplistic and may not be true predictive analytics, to really understanding some of the aspects of their conversation that can give you a clue. This company really will provide prediction and not just relationships. So with the terms that I've given you, just ask them to sort of explain the process that they use for their predictive analytics or machine learning or use of big data, so that you can have confidence that they will be the experts that you're hiring them for. Because it's not enough to have just good mathematicians. You want to have people that you have good relationships with and that you click with and that you have a good sense about. So if you found a company that you have a good sense about, that you feel that they have good integrity, you like what you see, my intent in this episode is to give you some tools to be able to have a conversation with them, so you can go a little deeper with them and have greater trust with them as experts, but most importantly, that they will serve you best by developing models that are specified for your context, and that they will help not only utilize theory in machine learning, but also to maximize use of your data to find the relationships that you yet have to discover. So hopefully these questions that I'm posing to you as possibilities to have in your conversations will help you find the right company. So now let's say that you've identified that this company you liked truly does do predictive analytics, and it looks like they do understand machine learning and use of big data so that they're really going to help you advance in understanding your predictors. The next thing that you should make sure to ask is about their security. So if the company is able to verify that indeed they do have all these securities that you've inquired about, make sure to ask for the documentation so that you can review that for its accuracy, its being up to date, and for its authenticity. So make sure that you follow through with that documentation, because the company should have good documentation of the most recent security reviews that they've had, about the insurance that they use, etc. So make sure that you get the documentation to review before you sign on the dotted line. So the reason that I wanted to do this episode is because predictive analytics has really become a hype almost. It's a buzzword, it's becoming a buzzword, and I want to provide some guidance out there for you that are looking to use predictive analytics of really what do I look for, what questions do I ask, because predictive analytics will guide you into uh, organizational refinement that's very effective. And if your model is done right, and you program the model to be specified to your organization, the results will resonate with the staff who are going to have to implement the actions for change. The reason it resonates is because you have programmed your organization story into the computer, and then when you analyze the data, it just tells the story back to the staff, but in an order of priority of what things they need to improve within their organization. So the staff will understand immediately what needs to be changed because it's their story being told back to them, but in analytics. Now, every time that I have used predictive analytics, it has improved the outcome dramatically, and it has literally saved $1 million every time. Now, that sounds almost too good to be true, but with careful calculations and working with the organization's finance department, we have been able to document at least $1 million of cost savings every time, and been able to show the improvement clinically. So the most important bit in this is that we are decreasing falls, we are reducing infections, we are reducing readmission rates, we are decreasing length of stay. All of these outcomes improve the patient experience, but we wouldn't be able to improve these outcomes if we didn't have a model that was specified in true predictive analytics, giving the staff a list of options in rank order to address as it relates to that outcome of interest. The other thing that's really powerful about true predictive analytics, as I've described in this episode here, is that it moves your organization, primarily the quality improvement team and the staff, it moves them from improving the frequency graph to the clinical scenario. So it moves them from paying attention to how many falls did we have today to what is the risk of falls for today. So it moves them to a critical thinking standpoint and really a professional enactment position where they're really enacting their professional role to reduce those risks. If you have any questions about predictive analytics, machine learning, security with your data, or anything else that I've mentioned today, feel free to visit my website to contact me or anyone in my company at healthcareenvironment.com, or you can email me directly at john@healthcareenvironment.com. Thank you for your time.